In humans, the natural hormone melatonin is involved in the sleep-wake cycle and in the endocrine function. A disturbance in the sleep-wake cycle leads to daytime fatigue, and this disturbance is one of the most common symptoms in people with brain tumors. Melatonin can stimulate the immune system and it can help to fight inflammation. For some patients with insomnia, the melatonin can help to improve their quality of sleep. As we gain more of an insight into melatonin's molecular mechanisms, it's becoming clear that it affects normal cells and cancer cells differently, resulting in selective harm to the cancer cells without harming the normal cells. Recent lab evidence has shown that melatonin can inhibit the viability and the self-renewal of glioblastoma stem-like cells. In a study on glioblastoma stem-like cells that were isolated from patients' surgical samples, the melatonin affected the cellular signaling pathways that were involved in cell survival and division. The melatonin may block the glioblastoma cells from invading new areas by inhibiting the genes that are involved in tissue invasion and new blood vessel formation. The melatonin may also interfere with the apparent energy production within the glioblastoma cells that otherwise allows them to divide so rapidly. In lab studies, melatonin boosted the effects of chemotherapy drugs, including temozolomide, indicating it might be especially helpful for patients who are undergoing conventional treatment. In addition, melatonin may complement the anti-cancer effects of repurposed drugs such as metformin, statin, and anti-inflammatories. It's been shown that the glioblastoma cells reduce the amount of melatonin produced within their own mitochondria, providing them with a survival advantage. In one early clinical trial, 30 patients with glioblastoma were randomized to either radiation therapy plus oral melatonin at 20 mg per day, or radiation therapy alone. After 1 year, 6 of the 14 patients taking the melatonin, and only 1 of the 16 in the control group were still alive. Those taking the melatonin had less hair loss and infections. The authors also noted that the side effects of the radiation were less frequent in the melatonin group. The potential for melatonin's use in glioblastoma needs further clinical trials. Vitamin D and some of its metabolites have been shown to stop glioblastoma cells from dividing in a lab setting. In one study, glioblastoma cells that had a mutation in a gene called p53, which is frequently dysregulated in glioblastoma, were more vulnerable to death when they were exposed to vitamin D. Intriguingly, one study found the levels of vitamin D receptor were increased in glioblastoma tissue samples compared with non-cancerous brain tissue, and that this was associated with improved survival. Patients with the vitamin D receptor present in their tumors had a better outcome in one retrospective analysis. A lab study showed that vitamin D enhanced the toxicity of temozolomide against the glioblastoma cells. Also, the combined treatment with temozolomide and vitamin D prolonged the survival, and it reduced tumor progression in a rat model of glioblastoma. Alpha-Silidol is an analog of vitamin D, and it was used in a clinical study alongside with the standard treatment for primary brain tumors. There were 11 patients, 10 with glioblastoma and 1 with astrocytoma. 3 of the 11 patients, 2 glioblastoma and 1 astrocytoma, showed a very favorable response with continued reduction in tumor and complete clinical remission for 7, 5, and 4 years. The authors proposed that 20% of those with high-grade gliomas may respond favorably to this vitamin D derivative. Among the many mechanisms possible for the effect of the vitamin D and its analogues, there's evidence that stopping glioblastoma cells from dividing and inducing senescence is a key. Vitamin D and the analogues of the natural form are continuing to undergo extensive research in this area. Selenium is an essential trace element, and it's an integral player in brain health, including brain cancer. The first clinical evidence of a link between selenium and brain cancers came when it was found that selenium levels in the blood were significantly lower in the patients with brain malignancies than in healthy individuals. Clinical studies have not yet confirmed the benefit of selenium supplementation for the glioblastoma patients, but lab studies suggest that selenium might reduce some of the negative effects of chemotherapy while making the cancer cells more sensitive to the chemotherapy. For instance, sodium selenate decreased the cell proliferation and it caused cell death in several types of human glioblastoma cells. In another lab study, sodium selenate inhibited the proliferation of the human glioblastoma cells and the rat glioma cells. A mixture of nutrients that contained several ingredients, including selenium, lysine, proline, ascorbic acid, and green tea extract, significantly decreased the ability of glioma cells to invade through a gelatinous material used in a lab study for tumor dissemination. A study that chemically linked the selenium to thiazolamide reported the new compound was effective against the thiazolamide-resistant glioma cells. Also, in human glioblastoma cells, the new compound caused DNA breaks, and it killed the cells more effectively than the thiazolamide alone. Boswellia, the naturally occurring plant compound, is under investigation for its anti-tumor properties. It's found in the gum resin of the Boswellia plant, better known as frankincense. Boswellic acids have shown promise in cell culture experiments and animal studies against several cancer types, including colorectal cancer, glioma, prostate cancer, pancreatic cancer, and leukemia. In particular, these potent compounds can induce cell death, suppress inflammation, decrease tissue invasion and blood vessel formation, and they can inhibit the signaling pathways that stimulate cancer development. In a mouse model of brain tumors, Boswellia reduced the tumor growth by normalizing several aspects of aberrant metabolism in the glioma tissue. In another cell model, boswellic acid stopped the progression of the division in glioma cells. A recent study described experiments designed to determine if the boswellic acid could enhance the anti-cancer effect of standard therapies like the thiazolamide or radiation. The treatment of human glioblastoma cells with boswellic acid led to cell death. When the boswellic acid was used in combination with the thiazolamide or radiation, a combined effect greater than the sum of the separate effects was observed, indicating the boswellic acid could be a promising integrative therapy for patients with glioblastoma. Boswellic acids are also helpful for reducing brain swelling, which can develop as a result of brain tumors or their treatment with radiation therapy. One study tested the effects of H15, a boswellic acid containing extract from the resin of the Boswellia serrata plant, on the brain swelling in 12 patients with brain tumors. The swelling was reduced in 2 of the 7 glioblastoma patients. In a second study, 44 patients with brain tumors took either 4,200 milligrams of Boswellia extract daily or a placebo while undergoing the radiation therapy. The Boswellia extract group had a significant decrease in brain swelling when compared with a placebo. An over 75% reduction of swelling was seen in 60% of patients who were receiving the extract versus a 26% of the patients receiving a placebo. In an uncontrolled study, a highly absorbable lectin-based Boswellia extract was used in 20 patients with glioblastoma who were receiving a standard care. Each of them consumed 4,500 milligrams of Boswellia daily for up to 34 weeks. Swelling around the brain was assessed at 4, 12, 22, and 34 weeks after the surgery, and the steroid consumption was also tracked. Steroid use was either reduced, stable, or not needed for most of the patients over the course of the study. 2 patients achieved a dramatic reduction of the edema that likely contributed to their improved outcome. The authors noted that the anti-inflammatory effects of the Boswellia on the brain likely led to a reduction of the steroids and their side effects as well as the better outcomes. Curcumin is derived from the Curcuma longa plant, and it's a component of the spice turmeric. Several lab studies have examined the cellular effects of curcumin on glioblastoma cells. Curcumin affects several cancer pathways that are necessary for cell division, survival, invasion, and metastases. Curcumin can reduce or even eliminate glioblastoma stem cells, which are notoriously unaffected by chemotherapy, by reducing their number, killing them, or changing them into a lesser dangerous cell type. One study used a form of curcumin that was bound to an antibody, and this was to help target the curcumin to the glioblastoma cell and the nearby microglia, a type of support cell in the central nervous system. The combination was used to treat mice with glioblastoma. The remission of the glioblastoma was noticed in half of the animals. Lab analysis indicated that curcumin kills the glioblastoma cells, and it improves the ability of the microglial cells to kill the nearby cancer cells. In another study in mice, the animals were transplanted with human glioblastoma cells, and they were treated with curcumin. The curcumin crossed into the brain. It inhibited the formation of new blood vessels and the breakdown of surrounding tissues in the extracellular matrix that otherwise allows for the tumor growth. In another animal glioblastoma model, rats that were given curcumin and were treated with radiation lived longer than when either the curcumin or the radiation was given as a single agent. The authors concluded that curcumin might be effective as a radiosensitizing agent for the gliomas. However, the dose that was needed to reach the brain to replicate these rodent studies might be too high for humans. So novel delivery forms of curcumin and curcumin analogues are being researched to overcome this hurdle, and they appear to be promising. There's also evidence that curcumin can enhance the efficacy of some chemotherapy drugs. In a lab study of glioblastoma cells, the curcumin increased the anti-proliferation and anti-migration and cell death activity of nimestine hydrochloride, a chemotherapy drug that's widely used for treating glioblastoma. This combined treatment might be a promising therapeutic approach. Curcumin can also enhance the effectiveness of temozolomide, and much like combining the curcumin with radiation, novel ways to enhance the effect through improved curcumin uptake into the brain are being studied. Curcumin may also have an effect on cancer cells through its ability to increase the production of ceramide, a type of fat molecule that's found within the membranes of the cells. This finding is important because the increased ceramide has been found to sensitize the glioma cells to chemotherapy. Resveratrol is found in certain plants, where its role is to protect the plant from infectious microbes. Nuts, berries, grapes, red wine, and Japanese knotweed are excellent sources of resveratrol. Resveratrol is being explored as a potential anti-cancer treatment because some evidence suggests that it can help prevent the instability of the genome, reduce the ability of gliomas to invade nearby tissue, and it improves the effectiveness of some conventional treatments. Resveratrol's potential as a therapeutic agent for brain tumours hinges in part on its ability to cross the blood-brain barrier, as well as its ability to inhibit proliferation, migration, and cell survival. In one study, resveratrol inhibited the growth of human glioblastoma cells, and it caused cell death in a dose-dependent manner. It also inhibited the growth of glioblastoma stem-like cells, and it suppressed the growth of glioblastoma in a mouse model. In another study, the resveratrol was able to prevent the cellular changes that are needed for glioblastoma cells to become invasive. The resveratrol inhibited a signaling pathway in these cells, and it suppressed the production of a protein that's involved in cellular invasion. In a lab study that used several glioblastoma cell types, the resveratrol inhibited cellular movement and invasiveness by activating a major signaling pathway. Resveratrol may also increase the sensitivity of cancer cells to temozolomide and to radiation. In one study, glioblastoma initiating cells were isolated from 2 patients with glioblastoma. The resveratrol sensitized these cells to the temozolomide. In vitro studies and mouse models, temozolomide more effectively induced cell death, and it inhibited cell migration when it was used together with resveratrol. Resveratrol might overcome thiazolamide resistance by reducing the amount of MGMT in the resistant cells. In a glioma stem cell line that was resistant to radiation, the resveratrol increased the sensitivity of the cells to radiation. The resveratrol also increased the ability of the chemotherapy drug paclitaxel to kill the glioblastoma cells. Quercetin is a naturally occurring plant flavonoid with many potential anti-cancer properties. Multiple lab experiments have demonstrated that the quercetin can kill the human glioblastoma cells. Quercetin can also inhibit the ability of the glioblastoma cells to metastasize, reduce their viability, decrease their ability to proliferate and to migrate, and to inhibit blood vessel formation. Other research found that quercetin may increase the sensitivity of glioblastoma cells to temozolomide and to radiation. The quercetin may also enhance the effects of chloroquine, an anti-malarial drug which has promising effects as an anti-cancer agent for glioblastoma. For more on herbs, supplements, and natural treatment plans, check out my website.